conceive, do, and plan to do, may the good Lord make us truly thankful and ever mindful of the needs of others. Amen.
Amen. Let's remain standing, please. We'll recite the forward test. Rotarians around, assume you have memorized it. We don't have it here today. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it bring goodwill and better friendships? Will it be beneficial to all concerned? And now let's put our right hand onto our left-hand side of the chest, and I propose a toast to the President of the Republic of Kenya. Thank you very much, and have your seats.
Good afternoon, my name is Natalie Bailey. I'm visiting from the Rotary-club of Coronado, which is located in California, United States, and my classification is dentistry.
My name is Suzanne Pop, and I'm from the Rotary-club of Coronado also. My classification is also dentistry, and we have a flag to exchange.
Awesome.
Good afternoon. Good afternoon. I'm Achoka Victor Mondale. I'm a Rotarian from this Rotary Club. My classification is pharmaceuticals. Thank you.
My name is Rafiq Shah Mohammed. I'm a developer and entrepreneur, social and economic.
Good afternoon, everyone. My name is Alex, Rotarian of this club, also the tree planting chair. Classification is dairy processing.
We are here as Rotarians from Nairobi to Nishi because we are parenting Rotary-club of Bahati. And Rotary-club of Bahati identified a project that requires a lot of support and help. And being young, they may not have the capacity and the understanding of how to go about it. But President Joseph of Rotary-club of Bahati did online contact with Rotary-club of Colorado in California, and they agreed to work on a dental outreach program.
My name is Janet Matenge. I'm from the Rotary-club of Karen, but on this project here that we're doing, that you just heard from President George, I'm here representing the district on that because I'm the district services chairperson. So it's very good to be here, and I'm so happy with what we're doing, and I am glad our guests from the United States are here to spur on this project with us because Joseph from Bahati is the one who started all of this. So it's my first time here, and I'm happy. Thank you.
I grew up being very involved with Interact and sort of Rotaract and going to a lot of youth exchanges and meetings and whatnot, but I've never been on an actual program project, if you will, like this. So this is my first opportunity. Both of us are dentists and care very much about dental needs. And when we found out about this from Joe, it seems like a really good opportunity to give back. It's looking like a much bigger project than I was expecting, but I'm very hopeful that we can at least bring something to the project and create something sustainable. I'm learning a lot about Rotary projects and grant proposals and all sorts of things that I can use in my future endeavors through Rotary. So yeah, thank you so much for having us.
To say the least, because women were allowed to join in 1987 and I joined in 1991. I've done many matching grants, smaller projects like just providing a computer or table and chairs, especially in Africa. And so this is the first large project that I've been working on too, and very excited to work with this area of Kenya, and I know we'll get something done that will help all the people, and hopefully this event will be something that could go worldwide like our End Polio Now. I'm very excited to be here. Thank you very much.
The reason we have a speaker who is a dentist is because we wanted to align somebody who will be relevant to what we've been doing all week.
He's a dental surgeon and a prosthodontist. I'm sure you understand what that is. The rest of us are floating. With over 10 years of experience, practicing at Nakuru Level 5 Hospital, as well as at Smile Dental Center, which is at CDN Plaza. He's graduated with a bachelor's in dental surgery and a master's in dental surgery at the University of Nairobi. He's very passionate in our areas that we are discussing today. That is aesthetic dentistry, ensuring that we can smile confidently and comfortably, and prosthetic dentistry, dealing with the replacement of missing teeth using dental implants, crowns, bridges, and dentures. Karibu sana daktari. The floor is all yours.
Thank you.
I'm glad to be here. Thank you so much for the invite, and thank you for the great introduction. My name is, as you have heard, Dr. B. Anthony. I'm a dental surgeon and a specialist in an area called prosthodontics. That's a very hard word I'm trying to pronounce. But simply, it's a dental specialty dealing with the restoration of heavily damaged teeth and also replacement of those teeth by either fixed prosthesis or removable prosthesis. So we are going to talk about dental fluorosis today, and that picture there, if you are to open your mouth anywhere in Kenya at a dental clinic, the first question you will be asking, are you from Nakuru? Because this is a signature smile. So dental fluorosis is present all over Kenya, but this severity is only found in Nakuru and its environs, from Naivasha all the way to Njoro. So we are going to cover dental fluorosis, talk about what it is, definition, how common is it, both generally in Kenya and specifically in Nakuru County. And very important, which should actually be a take-home message, is prevention. As the old adage goes, prevention is better than cure. So that is the most important line in that slide, prevention. And if it has happened, then how are we going to remedy it or manage it? So dental fluorosis is a cosmetic defect which affects the teeth. So it's very important to note that the ingestion of the fluoride that is in water, for it to manifest in the permanent teeth, it has to have been taken when the teeth are forming. When you see the teeth erupting, they already formed a long way back, a long time ago. So, for example, the upper front teeth, by the time the baby is about 1.5 years, the crown of those teeth have already formed. What we are waiting for is the root formation to finish, and then the tooth can erupt. But since that 1901 up to 1931, it was like a mystery. Nobody knew what was causing these brown stains in these natives of this state in the United States. But by 1931, there is a famous dentist who is regarded as the father of modern dentistry. He's called G.V. Black. He's the one who investigated fluorosis, and by 1931, they now were able to specifically point at fluoride ion being the causative agent of this fluorosis. What you call fluoride belts. That's where the fluoride levels are high in rocks and soil, and the people living in those areas are predisposed or exposed to getting. Most of the toothpaste that you use at home, you do not, when you have small kids who already have teeth, like from 2 years onwards, you tend to use the same toothpaste, everyone in the home. And some of those kids are not able to rinse well, they end up ingesting the toothpaste. And toothpaste, normal toothpaste, even if you go and buy Colgate, it's fluoridated and it has 1,000 parts per million of fluoride, when the recommended minimum is 1.5. So the very little which the kids ingest will later on manifest as fluorosis. So ideally, you should always buy, when you have small kids up to between up to 8 years, you should always buy them their own toothpaste. And if you go to the supermarket, you will get their labeled from 0 to 1 year, not 0 to 1 year, from 6 months to 2 years, 2 years to 6 years, and above 6 years, those are able to rinse and spit. But one of the main challenges actually, because I have a small kid, a toddler who is about 2.5 years.
That explains a lot.
So, how does fluorosis manifests when you examine clinically the mouth? One, you can have white opacities, like the first picture on my left. Then you can have yellowish, which is a remission, and the last one there is you can have either brown staining, black staining, with the surface of the tooth is chipped. They did a survey, and the main oral issues faced by patients in the Bahati area of Nakuru County was one, decayed teeth, and two is the discoloration of teeth after the brown teeth. The county referral hospital, we have to treat fluorosis by doing something called masking. For a single tooth, it will cost you 1,000 shillings. So if you have to do at least 6 or 8 teeth, the ones which are visible when the patient is smiling, that is about 8,000 shillings, and that's just the upper jaw. Then the lower jaw, another 8,000. That is very difficult for many Kenyans to afford, especially teeth is relegated very far off. You have to look for food, school fees. By the time you reach teeth. So the main ways to prevent and control this problem is one is alternative water sources with acceptable levels of fluoride. Systems. There is one which has been in existence for a while in Nakuru, which was being run by the Catholic Diocese of Nakuru, which uses bone char. That's the bones from butcheries, the ones which have been bought by customers. They are crushed, then they are heated to disinfect, and then there is some chemical process which they undergo so that they are sterile. After that, now they are used to scavenge or remove the fluoride ion in water. To fluoridate water is the use of newer systems, which are newer water filtration systems, which incorporate both filtration and reverse osmosis. Both free of the contaminants and the chemicals, which fluoride is among them. With this gadget here, it's called a nano filter, and it's small. You can see it fits in below the sink, in a house below the sink. It filters about 1,200 liters, 1,200 to 1,500 liters of water in a day. And you can even install 2 of them if you want more water.
Do you ever find that it's hard to bond materials to the stained teeth?
Yes, of course.
Yeah. Okay. And do you try it first, and then if it doesn't stay, that's when you recommend the crowns?
Most of the time, but it has been found that fluorous teeth will not bond. You have to do veneers or masking. Or if they bond for a very short period of time, within 2-3 years they disappear. So you rather just go direct to the crowns, so that at least you're able, because most patients, when they come for the treatment, and this treatment is expensive, they want a guarantee. So if you tell them that it's 50-50, they won't take it.
We learned that this fluorosis starts when the fetus is 5 months in the stomach. And that's why when it comes out or whatever you drink, there's nothing much you can do when the child is in school or something like that. And also, we learned, even today, that children could be taking the same water, or parents or a pregnant mother, from the same tap as another mother. Her kids the teeth come out all white, etc. And the other mother, the teeth of the children are all brown from the same drinking source. And so we're probably in the process of learning or understanding that it's also nutrition, because if one parent can afford to buy milk and drink milk when the baby's in the stomach or when the baby is small, and the other can't afford anything like calcium and so on, that's where the difference might be. What's your opinion on that?
Can pass through breast milk, so the babies who are breastfeeding can actually get a high amount of fluoride in the breast milk, but normally it's not as much, say that it causes either moderate or severe fluorosis. It will be within that allowable concentration. Yeah.
It has been a wonderful exposure. I think the whole process we have gone through, capped with Dr. B's presentation, really has added up a lot of value. Is it possible to share with us your presentation?
Yes.
Please, it will be wonderful. And please, let's have our right hands on our left chest. I'll give you Rotary the world over.
Rotary the world over. Thank you very much. Enjoy your afternoon. And take the chance to know somebody you didn't know. Say hi to someone. If you had a question I didn't give you a chance, please, Daktari is here.